Good evening, everyone. I'm honored to be here with my esteemed colleagues, with the esteemed audience. Dr. Axelrod, thank you for inviting me, and of course, Judge Steinhardt, who I love when you come to visit. I'm so happy. It's not very often anymore. So this is a topic near and dear to me, and my whole talk is actually about what is new, what the new narrative is in breast cancer. And I Hate Pink is a personal motto of mine. October, as you know, is Breast Cancer Awareness Month, and pink is all over the place. I'm tired of seeing it. I hope breast cancer someday does not exist, so we never have to see pink any longer. So let's talk about some strategies and how the narrative of breast cancer has changed. If you look at healthcare today, it's all about disease. It's not about understanding wellness at all. And that's a very important narrative that has really changed over the years, and especially very recently. What survivorship does is it really looks at breast cancer from a wellness perspective. You've been diagnosed, you've had breast cancer, perhaps you're the loved one or a friend of someone with breast cancer. What can you do going forward? How do we take this devastating event and turn it into something that can be a pivotal moment to make you healthier? So the first important thing is, who is a survivor? And the current definition is it's an individual. An individual is considered a cancer survivor from the time of diagnosis through the balance of his or her life. Family members, friends, and caregivers are also impacted by the survivorship experience. So why is survivorship important? Many, many reasons. Number one, it provides care and management strategies as one transitions from diagnosis through treatment and beyond for the rest of his or her life. For survivors and caregivers, the post-treatment years can have physical and psychological change, which can be devastating. It can change the whole persona. Survivors live in a very ambiguous space between well and sick. You're considered, quote unquote, sick, undergoing through therapy, you're having side effects, but still you have to find a part of you that looks at the wellness aspect of this. How can I take this experience and both psychologically and physically become better and healthier? And most importantly, probably, is that survivor is not only descriptive, it's meant to mobilize those involved into action, and you'll see why this is so important later on. Survivors experience long-term changes after completion of treatment, which affected overall quality of life. Now, this is a very modern statement, but you might be surprised to hear that this actually appeared in a British medical journal in 1996. So this is not a new concept. It's something that we knew about, but what's going on? This was close to 20 years ago. So if you look at breast cancer development as far as drug development through 1996, a lot has gone on. As Dr. Guth said, chemotherapy is relatively new. The first combination chemotherapy for breast cancer really was not available until the mid-70s. And there's been really explosive changes over the past 15 years, from Herceptin to different ways of giving chemotherapy to aromatase inhibitors, lots of drugs, gemcitabine, Taxotere, small molecule drugs, lapatinib, PARP inhibitors are new. And more recently, what's called TDM1, a drug called TDM1, CDK inhibitors, everolimus. So there are lots of new drugs that are very exciting in breast cancer treatment. However, when we look at survivorship development, it's a little bit schwach, as they say in the old country. 1986, the National Coalition for Cancer Survivors was developed. In 2005, one of the pivotal moments in survivorship came about with the Institute of Medicine policy mandate. And they were a bit ahead of their time. What they mandated was that by the year 2015, all patients who were survivors of breast cancer, which at that point meant at the completion of treatment, had to be actually handed a patient summary report as well as a survivorship plan. And then more recently, 2013, came the ASCO, which is the American Society of Clinical Oncology, and the NCCN guidelines. And even more recently than that, there has been quite a lot of research being done in survivorship science. So it's not simply observational studies, but there's a lot of laboratory research being done to try and figure out what is it about obesity and breast cancer? What is it about diet, exercise, and breast cancer? What is the link to that? So why is progress so slow? It's slow because it's overshadowed by prevention and early detection. Prevention is a very big word, a very big buzzword in our society. Early detection is a very big buzzword. Survivorship is a little slow to sort of come on the scene. There's failure to recognize a teachable moment, and a teachable moment is a phrase that's used in cognitive therapy that points to a moment where the person is ripe for change. And in fact, people who have breast cancer at the completion of treatment are very, very ripe for change. But this ripeness really dissipates very, very rapidly, and we have to take advantage of that moment. And probably the most important issue is policy. If we change reimbursement, we will change practice. And one of the important issues is that a lot of survivorship treatment and a lot of survivorship recommendations are not covered at all by insurance. So the time is now for survivorship, and this is one of the important forward motions of breast cancer. Survivorship dates back 30 years when we realized that support groups actually made people feel better and gave them an important improvement in quality of life. The number of people with breast cancer is rising. By 2020, 18 million Americans who have had cancer will be alive. And interestingly, about 18% of them will have had a previous cancer. Breast cancer accounts for 23% of survivors, and only 13% of cancer care facilities have formal survivorship programs at this time. So why is breast cancer and survivorship the perfect match? They really do go hand in hand. And as the previous speakers have discussed, breast cancer has been a paradigm for a lot of things, and so it is for survivorship. For several reasons, the first being that the complexity of care makes it a perfect model because there are so many things that go into breast cancer treatment. There's complex treatment, there's multiple physicians. As Dr. Guth mentioned, it's a multi-modality approach. We're using surgery, radiation, chemotherapy, hormone therapy, using psychosocial therapy. There's so many aspects of care. There's the potential for early, late, and long-term side effects. Cancer may be over, but the side effects unfortunately remain. There is the existence of large numbers of breast cancer survivors, and this is a good thing. If you look at some other cancers, there are really a paucity of survivors, but breast cancer gives us lots of people to work with. I'm sorry. There is expected growth as the population ages. There's now extended period of endocrine treatment. So for those of you who know about a drug called tamoxifen, the recommendations recently have gone from 5 years of treatment to 10 years, and with it, of course, comes extended side effects. And very, very importantly, I'm happy to say that the 5-year survival exceeds 90%. So all of the women and men who are living with breast cancer, the over 90% of people, all have the potential to have side effects from treatment. To give you an idea of the impact of breast cancer, I thought that this quote really says it all. I've experienced firsthand the tremendous impact breast cancer has on the women who fight it and the loved ones who support them. This is a disease that catches you unaware and without the right resources leaves you feeling frightened and alone. Ricardo Antonio Chavera. So for our first important knowledge question, who is Ricardo Antonio Chavera? Just click a 20. Oh my goodness, this is a good question. And Ricardo Antonio Chavera is actually the husband of Eva Longoria on Desperate Housewives. So I think that I probably underestimated the this audience, and probably should have gone in depth about more biology and less fun. Okay, well that was good. And then another theme that's been quite prevalent this evening is that breast cancer is a truly potpourri of diseases. Although breast cancer is one phrase, each survivor is unique and each person's experience with survivorship is unique. And that's why the programs with survivorship have to be unique. So what are specific survivor questions? Basically, they come down to what do I do now that treatment has ended? How do I live better or longer? Who will answer my questions? Who will update me of the latest findings? How should I expect to feel and for how long? Who will order my mammograms, pap smears? What should I do for health maintenance? And who will get and recommend my screening for related cancers? And these are just some of the questions that come around when a person has completed their treatment. It's sort of that, what do I do next? And they feel very, very lost. So the first step, the nuts and bolts of the Institute of Medicine's recommendations were really what's called a survivorship treatment summary and care plan, which basically is a document that's filled out either by the physician or a nurse practitioner or a nurse and is given to the patient, which summarizes basically their diagnosis, their stage, characteristics of the tumor, what treatment they got, what potential side effects they may have, what support services they got, contact information, and very importantly, the care plan or the follow-up guidelines. What are they? Who will do it? A copy of this it's mandated to give a copy to the physician, and very, very importantly, a copy has to be sent to the person's primary care doctor. And the reason that's so crucial is we're rapidly running low on medical oncologists in this country, and a lot of the care will be taken over at some point by the person's primary physician or internist. But even until that point, most of our patients are still seeing their local doctor, their primary care, their internist, and very often they feel marginated and they feel like they've been left out of the whole process. So if we as oncologists are going to turn our patients out into the real world and make them feel that they are well and that they're survivors, it means going back to their internists on some level, and their internists need to be informed. So survivors need strategies for wellness. It's one thing to see somebody on the last day of treatment and say, you know, you did great, everything, you're a trooper, you came through beautifully, I'm so proud of you, you were wonderful. And then say, so I'll see you back in 2 months and, you know, go out and live your life. Well, what does that mean? So the ASCO initiative is to take advantage of this teachable moment that I mentioned before. And what that does is increase education and awareness, to increase the awareness that there are lifestyle differences that can be made to improve survival, to provide tools and resources for those changes, and extremely importantly, to foster research, the pathophysiology, what causes this link between obesity and breast cancer, behavior changes and outcomes, what are the best methods for lifestyle changes. Any of us who have been on a diet know how difficult it is to stick to it, and to advocate and improve access. And again, advocating is crucial because if we don't advocate, we can't change policy. So what are strategies for living well? They must be holistic and individual. It has to plan for the future but be rooted in the present. It needs to optimize lifestyle and open the dialogue. Your goals are your goals. Your goal may not be the same as the person next to you. They may not even be the same as your doctor, but they are important to you and they need to be treated with respect. And it uses integrative therapy for both physical and emotional symptoms. So why, again, is breast cancer such a good cancer to use for survivorship? Because there are so many problems that come after treatment, and those problems can be life-altering. Hot flashes that never stop, as some people say, it's your own personal beach. Osteoporosis, fatigue, weight gain, depression, anxiety, cognitive impairment, sexual dysfunction, neuropathy, fertility, lymphedema. And interestingly, most of those can be treated quite effectively with integrative treatments such as acupuncture, massage, yoga, meditation, lifestyle, and guided imagery. And on the right column, the one important thing that is new over the past several years that we really didn't realize before is that survival can be impacted as well. So this is not just a look good, feel better, it's not losing a couple of pounds, but it has been very well shown that both in pre- and postmenopausal women, mortality of breast cancer is related to obesity. So what is a healthy lifestyle? There are several components, the most important being weight management measured by your body mass index, physical activity, dietary habits, alcohol, tobacco, practicing safe sun, age-appropriate screening, meaning colonoscopy, as an example, and prevention, meaning things like immunizations. So our next question is, a healthy lifestyle does all of the following except A, improve outcome, B, increase fatigue, C, improve quality of life, or D, decrease risk of recurrence. Excellent. The answer is B. A good lifestyle does not increase fatigue. All that healthy exercising that I know you're all going to want to do when we finish tonight does not increase fatigue. In fact, it does the opposite. So if you thought cigarette smoking was bad, it is. However, obesity is quickly overtaking tobacco as the leading preventable cause of cancer, and it's estimated that about 84,000 cancers this year were related to obesity. So that's what a major impact it's having. So what are some of the myths against these good lifestyle changes? Well, there's many of them, and I'm sure they've crossed through your minds at one time or another. I can't exercise during treatment. I shouldn't exercise during treatment. I can't eat well after treatment. If one vitamin is good, 20 is better. Supplements can cure me. Supplements can make me lose weight, and I can take vitamins instead of eating broccoli. I can't lose weight on treatment. Treatment will make me lose weight. It's too late to think about lifestyle changes. Natural means safe. The right diet can cure cancer, and if I can't go to the gym, I might as well sit on the couch and watch Dr. Oz. Sounds tempting, right? So what are the benefits of exercise other than if survival is not enough of a benefit? Here are some others. They increase fitness and muscle strength. Weight loss is easier to come by. It improves outcomes. It improves mood, decreases fatigue, gives you better treatment tolerance. If anyone is on aromatase inhibitors, they are drugs which are hormone drugs used for breast cancer. One side effect are aches and pains, and exercise can ameliorate that. And also extremely importantly is empowerment. It gives you control over your body. It takes that sickness and turns it into control and wellness. So what's the link between obesity and breast cancer? It's a great question. We know the link is there. We don't know what it is. Perhaps obesity causes increased levels of insulin and estrogen. Perhaps there are cytokines that come from the fat cells. This is a very, very fertile area of research that's being done right now. So what do you do about this? Well, but if those of you can't read it, this says, my doctor told me to increase my activity, chewing, changing channels, and napping are activities. Well, in the spirit, as they say, in the spirit of the law, they're not. But even if you have to start slowly, it's worth starting. And what this says, if you haven't exercised in a while, you may need to stretch and warm up before you stretch and warm up. So anything is better than nothing. Walking a block is better than sitting in front of the TV. So hand in hand with exercise, of course, comes nutrition. One does not go without the other. So if this looks really good to you, it should look really good, and this is what you need to train your mind to feel that what this is Moroccan couscous, whole grain with vegetables, very delicious. I wish I could say I made it myself, but I didn't. This is not so good, and this is a nutritional label from a container of ice cream. So the next few questions are related to this, and I'll flip back and forth, but I just want you to take a moment of looking. For those of you not familiar, basically this is a typical nutritional label. You find it on everything. It gives you serving size, it gives you servings per container, it tells you the calories per serving, and the rest of the nutrients per serving. So let's look at the first question. I'll flip back after we see it. So if you eat the entire container, how many calories will you eat? 500? 1,000? 250? Or what do you mean if? So let's go back again. If you eat the whole container, I'll give you a moment to read that and then I'll flip back. Uh-huh. Okay. That was very good too. The correct answer is 1,000 because, to go back again, if you see there's 250 calories in one serving and 4 servings in the container. If you're allowed to eat 60 grams of carbohydrates, how much ice cream could you have? 1 cup, 4 cups, 12%, or for those thinking ahead, is whipped cream a carb? So let's go back. Again, carbohydrates are close down to the yes, it is. So the correct answer is 1 cup because each half a cup, which is a serving, had 30 grams. And finally, the last question, if you usually eat 2,500 calories a day, what % of daily calories will you eat in one serving? 5%, 10%, 40%, or is 2,500 calories a lot? It is. So let's go back a moment to the... So actually the answer is 10% because there were 250 calories in one serving, so that's 10% of 2,500 calories. So one important thing to also remember is that supplements are not food substitutes. A handful of pills, for those of you who partake in helping the billion-dollar nutritional industry of supplements, does not equal a hand of broccoli. Basically, supplements in the United States are not FDA approved, and it's been very well shown that eating your vegetables is much better than popping them. So in summary, I think the future of breast cancer is certainly surgical, radiation, drug development, all that is crucial. And of course, while breast cancer exists, we won't be able to cure people without those important modalities. But likewise, the treatment of breast cancer is a very short part of the entire path of breast cancer. And survivorship is an important way to live your life. And you can live your life better if you love yourself enough to create a healthy lifestyle. So I hope you all do. I hope that you take some good points away from this. And just to end, what this says is, of course donuts are good for you. They're whole grain. Thank you for your attention.